right, good afternoon, everyone. Is this on? I think you can hear me anyway. Welcome, and thank you all for joining us for the third annual Global Health Initiative Faculty Forum. As many of you know, this is a very important annual event which brings us together as global health faculty from across all of our campuses and in various ways, and we have, I think, a little bit of a creative way this time. We engage in conversation about our current work and looking ahead, obviously, to the future as we plan the year. And that, of course, is, and John will talk more about this, but is the purpose of the Global Health Initiative, which is to facilitate and encourage collaborations and to help us to leverage our strengths and opportunities. I'm especially looking forward to this afternoon's rocket presentations. I don't think we've done this before in the global health setting, so I think it's going to be interesting to hear about a lot of things in a short period of time. And then the conversations that will take place after and ongoing. I want to thank especially the members of the Global Health Initiative Faculty Committee. Over the last few years, this group of faculty has taken time away from their daily work and their schedules to really provide guidance and support to this university-wide initiative. The successes we have had, and John's going to talk a little bit about those, would not have been possible without the engagement and guidance of the faculty committee. And I'm very much looking forward to working together this coming year. We have a busy year coming up. I also want, of course, to thank all of the Georgetown faculty members who are here, who have joined us, or who will join us. Today we have three sessions, I guess, and I think some faculty will come and go based on other obligations that they have. But each of you plays a unique role at Georgetown, and we greatly value your work and leadership, whether you're mentoring students and preparing them for a career in global health or carrying out important research or other service. As always, I want to thank my partners in helping to lead the Global Health Initiative, Tom Banshoff and John Monahan. It continues to be just a great pleasure to work with you both. And a special welcome to Maeve McCain, the Executive Director of the Global Health Initiative, and a wonderful new faculty member. Where are you? There you are, Maeve. Thank you. So today is part of a celebration of our successes, but we also look to those in this room and beyond, of course, the other faculty, for your guidance on how the Global Health Initiative can continue to support your work and be a resource really across the university as we stated at the beginning. However, none of this work would be possible without the exceptional leadership of President DeGioia. 3 years ago, it was President DeGioia who emphasized that global health is a strategic priority at Georgetown, and it was his leadership that led to the creation of a university-wide platform to support the faculty, students, and staff. And I'm so grateful for your continued leadership, Jack, in these efforts. Thank you very, very much. Now, it's my pleasure to invite President DeGioia to the podium to make welcome remarks, and following that, John Monahan will bring us up to date on the Global Health Initiative. Thank you, Jack.
Thanks very much. All right. Well, thank you very much, Ed. Those very kind words. Thank you for this invitation, and to you and Tom and to John, to join all of you this afternoon to share in some of the extraordinary work taking place in global health on our campus and as part of our university-wide global health initiative. And we're grateful to you for your leadership and your contributions, which have brought us all together today. Special word of gratitude to each of the members of our faculty who are here today for your presence, for sharing your expertise with our students, for your dedication to improving the health and well-being of our global community. This gathering is an extraordinary representation of the range, diversity, and depth of the global health community here at Georgetown. And I'm grateful to each of you for the deep care and commitment that you bring to global health and the efforts that you share today. And I look forward to the ideas and insights that will emerge through these conversations and through our rocket rounds and through our time together. Also, I'd like to add my appreciation to Maeve and to John, who play an integral role in convening and facilitating our work together. Thank you both for your leadership. Our community, through our mission as a university, our identity as a Catholic and Jesuit institution, is grounded in the commitment that what we learn, teach, and research is intimately connected to the world that we experience and to the local and global contexts in which we pursue our work. And there's no place that this is more evident than in the study and practice of global health. 3 years ago at our medical center, we launched the Global Health Initiative, a realization of the exceptional work that was taking place across our campus as well as the aspiration that we have for its continued growth and development, both on our campus and across all of our schools. We knew there was more work that we could do. We knew we could build upon the exceptional work taking place, but also we thought there was a way we might be able to, find our way into something perhaps even more transformative for our university. We had 6 goals when we began this initiative: to strengthen our community, to deepen collaborative research, to enhance our policy impact, to engage our students, to attract new colleagues, and to achieve new levels of sponsored support. And it could not be more apparent today of the deep realization of our efforts in each of these goals. More students than ever have sought to be engaged in this work. More faculty are working together across our campuses, supported by Global Health Initiative research grants. There are more opportunities to come together as a community of scholars with policy leaders to shape research, to influence dialogue, and to help inform policy. We've welcomed some extraordinary new colleagues who are already making important contributions to our community, to this work. And over this time, as you have pursued your research, engaged our students, you've done so in a context strengthened by the insights of your colleagues and the new kinds of connections across our centers, institutes, programs, and schools. This initiative embodies our commitment to excellence in research, teaching, and service, and it models what it means to collaborate across our campuses. So it's an honor to be here for this annual convening. I'm grateful to each of you for the experience, the perspective, the passion, the idealism, the care and commitment that you bring to this important interdisciplinary effort. And I look forward to hearing more about the exciting work that is underway. And I want to thank you all again for being here. And now it's a privilege to introduce somebody for whom this work has been a labor of love. When others weren't always certain that the vision that we are now celebrating today was even possible, John was the champion to ensure that we try to realize our full promise and potential as a university, especially in our ability to focus our talents and our values in a way that brought out the possibilities in global health. So John, it's an honor to be with you and to thank you for everything you mean to this place.
I'm not sure I want to say anything else now after that nice introduction. So now one question I have is the slides. Do we have? I'm sorry. Oh, this one. Okay. So let me just one quick introductory remark is that, as you know, for each of the last 2 faculty forums we've tried to go back to the 6 goals that Jack articulated at the first meeting, and to review our success or challenges where we have to as a university. So what I'd like to do again this year is review what we've done over the last year. And I think also to remind us that the initiative at its core is about lifting and leveraging our strengths, and of course in no way substitutes or stands in the way of the resources of the faculty, the departments, the schools. This is our chance to do even more as a community than we would otherwise. So let me just do a quick update for our community here, if I got this. So just a quick history. I think you all know President DeJoy laid this out, and in your materials there is a handout of the successes and the challenges we have had over the course of the last 3 years, but really the progress we've made on all 6 goals. And just as a reminder, this is an initiative that is jointly funded between the Medical Center, led by Dr. Hilton, and by the Office of Global Engagement by Dr. Banshoff. It's been and I really would say their leadership has been indispensable in this, because a university as big and decentralized as ours, having 2 institutional leaders making a financial and leadership commitment over time has really been indispensable to our success. And of course, I'm going to do a longer introduction at the end, but we are really excited that we now have Maeve McKean joining us as the executive director for the initiative. So let's look at each of the 6. So stronger community. We had more than 25 events over the last year sponsored by GHI. Our website has become stronger and more robust with a lot of original content. We've had more people come to our website than ever before. We've had a series of high-level speakers throughout the course of the year, and of course our reach in terms of our distribution on campus and in the Washington policy community has only grown. I would just add that one innovation in the last year has been adding content written by students. So blog posts and reports by students in our academic programs are now a regular feature of the Global Health Initiative website. Collaborative research. As you know, one of the central pieces of this initiative over the last 3 years has been faculty grants. We awarded 12 grants in the last academic year, totaling $126,000. It brings us over $350,000 during the course of the initiative. We also used some relatively small grants to seed early stage planning for either meetings or programs that wouldn't otherwise have been possible. And then another feature that was new in this last year was the addition of brown bag lunches. So for faculty who have either completed one of our grants or in the process, we've invited people to come and talk about their research with other faculty and students, and that's been well received. A third piece was high impact recruitments, and as you know, with the Global Health Initiative, we have hoped that the building of community and the sense of a university-wide community will help create the opportunity and the conditions for successful recruitments, which we've had over the last few years. And just as a few examples, the biggest piece of the last year was, of course, the recruitment of Dr. Deus Bezira and his colleagues who joined us from the University of Maryland, Baltimore. But we've also had the chance to welcome new leaders, including Dr. Panagrahi, Dr. Das, and unfortunately, my colleague here, Matt Kavanaugh, who I know is here, I had the wrong date for your entry, so we're just as excited this year as we were last year to have you part of the team. But the point is that I do believe, and I think we've heard this from people who've been recruits, the chance to be in an academic university where there's a commitment to global health across the university makes a difference. I won't go through, we've had, as is typical at Georgetown, we've had many briefings and interactions with policymakers both in Washington and people on campus. One thing I would note in particular is we did have a launch of the Lancet Commission on Global Health and Law that I had the privilege to co-chair with Larry Gostin at the law school. We had a terrific rollout in May at the law school, and we just had a side event last week at the UN General Assembly announcing the launch of a new commission, a new initiative on what we call Universal Health Coverage Legal Solutions Network, which is to work with countries who are working on universal health coverage legislation. Number 5 is in students. This is maybe the most exciting development of the last year. We've had 20 Global Health Initiative Fellows. This fall, we had the largest class of applicants ever. This is clearly an exciting opportunity, and when you work with, each of you who work with the students as part of the mentored fellowships, you appreciate it, but also seeing the cohort come together and learn together at lunches, and we've had some social events for them. It's really a terrific chance to see students from all of our schools coming together. And I guess, I should say one other innovation this last year is that Maeve and I taught a 1-credit class in the spring where we brought together for 6 evenings leaders in global health and asked them to just come and talk about their lives and careers. So Tony Fauci, Lois Pace from the Global Health Council, Beth Cameron from the Nuclear Threat Initiative. These were all distinguished global health leaders who came to talk to our students about their lives and engage with them. And then finally, we also believe that the sum of these previous 5 steps, I think, brings Georgetown to a place where we've shown what we can do with the resources and investments we've made as a community. And it's an opportunity, we hope, for investors who look and see what more we could do. I think we all know it's really important to have a proof of concept of what we can do to give people a vision of what they could do if they had a chance to invest. And so we're hopeful that that will come from the Global Health Initiative, as well as obviously the support that the initiative tries to provide to individual faculty as you pursue your research grants and opportunities. So I wanted to just use this opportunity as just an update like we do every year, so it's sort of a state of the initiative. But now I want to take a chance to introduce the newest member of our team, so to speak, which is our colleague Maeve McKean. And Maeve is a half-time executive director. She's based in the medical center in Ed's office. She is a distinguished human rights lawyer. She is a friend and colleague. She has experience at the U.S. Department of Health and Human Services, at the State Department, in academia. She has worked at the intersection of public health and human rights, particularly around HIV and women. And I just think she brings an enormous set of talents and skills that will make a huge difference to our community. So Maeve, I want to introduce you to have you walk us through how the day is going to work, because I've never run a rocket round, but I trust that you will. So thank you.
Thank you so much. Everyone knows that John Monahan is one of the great complimenters, and thank you very much, President Joya, for joining us today. Yes, we are going to have 2 rocket panels. The first one is going to be, as you can see in your program, to discuss degree programs at Georgetown, and then the second will go to the Global Health Research Centers. To just remind everyone what a rocket panel is, and this is completely antithetical to being an academic, is you're only allowed to speak for 3 minutes, and you're only allowed to have 1 slide. And anyone who's ever seen Debbie Burks give a presentation, who is the head of our current president's emergency plan for AIDS relief, this is also antithetical. But I'm really grateful for everyone's patience and kindness as I requested this as a way forward. So the 3 questions that we'll be responding to is, 1, what are the current global health challenges that your center or your academic program is responding to? So really looking at, what is the landscape today? Secondly, talking about how do you see your program working to adapting and evolving for the political, social, and economic changes that are taking place? And third, how are you and your work, how are you placing yourself on the forefront of these issues and demonstrating and reinforcing Georgetown's leadership role in responding to those constraints and those opportunities? Again, in 3 minutes. And so with that, Amy has graciously keeping people to time. And then, as I've said before, that if after each session, we're going to open it up to questions and answers for the audience. This really is supposed to be an opportunity for all of us to come together and talk, and so really grateful for those conversations as well. So the first session will be on degree programs, so Professor Singer, Professor Apter, Professor Lisi, and Professor Kavanaugh, if you could join us up on stage. And then we'll just go in the order of the program. The slide should be all set, so you just cue to your next slide. And with that, we'll start with Professor Singer. You're first, yes. And you start there, please.
Okay.
And you should be able to look
Oh,
at this screen.
great. Well, thanks for putting this together. And there it is. Great. So I am here representing the undergraduate major in biology of global health. It's a degree program that we've been running for about 12 years within the biology department. And most of our students arrive on campus, probably 70%, convinced that they're going to medical school. We don't try and change their mind, although I think some of them definitely do end up changing their mind after they go through the program. What we try and tell them about are both communicable diseases and non-communicable diseases, and to understand both the biological drivers of these diseases, but also how social drivers or socioeconomic factors impact on both of these. When we were getting educated, infectious diseases were the big player around the world. Now they're on the way down by and large, not all of them obviously, and non-communicable diseases are on the way up. Some of that is biological and a lot of that is not. So trying to understand how those different factors interrelate is really what the program's about. Because we're the biology department, we do emphasize the biology, but we want our biologists to understand that there's more going on than just the biology. And I think for our students, that's what's really the most eye-opening. In terms of specifics in the curriculum, we try and do things that are a little different, I think, than the rest of the biology curriculum, in that there is an additional math requirement that's not present in it, as well as an emphasis within our only required course for this major, the Gateway to Global Health, on communication skills and group work. And the students are doing presentations in various formats, podcasts, policy papers, as well as grant proposals, and more traditional sort of science writing. And in the end, the students are going off to medical school, but also to MPH programs and to NGOs in town. I fondly remember some of our alumni who are at either CSIS or the Sabin Vaccine Institute in town doing great work. And then I didn't put on the slide, but looking to the future, thinking about that more, has been trying to imagine, as we're going to hear of some of the master's programs that have developed on campus since we launched this bachelor's, is creating 5-year options. We do now have a BSMS option for biology of global health within the college, and then global health within the School of Nursing that Dr. Lisa will talk about in just a minute. And with the new infectious disease masters that Dr. Apter will describe, that there's an opportunity there, once that program's running a little better, to make another joint program and to find efficiencies in the teaching and the programming for the students. Questions are later.
Excellent. Thank you so much to everyone here today. As I look out into the group that's here, I'm the newbie here, and I've had the lovely chance to work with many of you over the past few months and years. I've been an adjunct professor, it's going to my 4th year, and I've been lucky enough to work with many of you on the new MS program in global infectious disease. And to start out, I think we all recognize that infectious disease remains among the top transnational challenges facing populations today. And infectious diseases impact lives, livelihood, the movement of people and goods, and at times, overall social structure and governance. Think of the recent experiences with Ebola in West Africa, which is ongoing in the DRC. Think of the disease that emerged in my lifetime, HIV, and its impact on families, communities, and economies. As we've all experienced, infectious disease can quickly evolve into a global emergency that requires a coordinated global response. And while there has been tremendous progress designing tools to prevent and cure many diseases, the emergence of new diseases and the reemergence of diseases once thought to be controlled are the result of a complex and globalized world in which we live. The Global Infectious Disease Program recognizes today's reality, in that combating these diseases requires the ability to effectively communicate and coordinate amongst decision makers from multiple disciplines. The program addresses the complexity of working in this space. It recognizes that combating diseases requires a range of tools, including designing preventative technologies and approaches, development and deployment of effective therapeutics, advanced computational modeling for predicting and surveilling disease transmission, and strong supporting international and national public health policies focused on improving health. Therefore, the design of this unique program was undertaken across the entirety of Georgetown University, and I think you are all sitting in this room today, including the college, the Graduate School of Arts and Sciences, the medical school, the School of Foreign Service, and the law school, led by my colleague, Professor Steve Singer, and the director of the Global Health Science and Security Center, Rebecca Katz. They designed a fit-for-purpose design that paralleled the multidisciplinary training needs of our future infectious disease leaders. The program will provide candidates with the ability to understand and communicate across a complex set of disciplines, with the support of cutting-edge research and evidence to effectively respond to infectious disease, including understanding the international health regulations, frameworks, and conventions, understanding biomedical advancement and their appropriate and ethical deployment, and the ability to apply analytics and computer modeling to predict outbreaks, disease spread, and anticipate the impacts of different interventions. With the emphasis on the intersection between policy and biological sciences, the Global Infectious Disease Program has 2 concentrations, policy and disease modeling. It is the only master's level program in the United States to offer an opportunity to train in infectious disease modeling. So whether it be the decades-long response to the global HIV pandemic, fighting immediate outbreaks, research to understand the impacts of Giardia on childhood nutritional status, or negotiating the details of international governance related to infectious disease, the global infectious disease faculty have been on the leading edge of the response, providing deep experience across many departments and agencies of the United States government, public health implementing organizations, the private sector, and philanthropy. The 18-month Global Infectious Disease Program at Georgetown offers the ability to have real-life lab in your backyard, to engage with the U.S. and international decision makers, and contribute to the Georgetown community of scholar practitioners working in global infectious disease. Thank you.
Good afternoon, and thanks. And Maeve, since we have two programs, I could have 1 minute more? Yes. All right. The department offers 2 degrees, a Bachelor of Science in Global Health, and for the graduate school, it's a campus-wide program, a Master of Science in Global Health. Actually, the Bachelor of Science started in 2003, and it was, surprisingly, the first undergraduate international degree program in the United States on health. Today, as we call it, global health. The program was conceived at a time of great optimism. You know, PEPFAR was created, Gavi, the Global Fund. You know, things seemed to be, the world was wide open. And Jeffrey Sachs had documented that in the Macroeconomic Commission, that economic returns of investing in health were indeed enormous. Therefore, official development assistance for health rose dramatically. Obviously, the world is different today. It surely is. ODA for health is flat, slightly declining. Infectious disease, we heard that, are still around. They will be with us. New ones are coming, quite a few. In addition, current new challenges have developed, just to mention 2. Antibiotic resistance and vaccination refusal. If the 10 Commandments were handed down today, there would be an 11th one. Thou shall be vaccinated. Vaccine is still the most powerful health intervention tool which we have in public health. There's no question about that. Where would we be in Ebola today in Zaire if we wouldn't have the new vaccines? But not all. The world has become rapidly urbanized. Informal settlements are happening everywhere. Slums are growing. And we always think about Asia, but it's not Asia where they're growing fastest. It's basically medium-sized cities in Africa without any investment in sanitation. The health consequences are pretty clear. Cardiovascular diseases, diabetes, and mental health, which was once relegated 20 years ago as something, there are now major issues. It has emerged as a leading cause of the global burden of diseases. And finally, we have been waking up to the enormous health implications of global warming. Our undergraduate programs have evolved to reflect this. Core science courses have remained the same, but the electives, the whole focus has been changing over times. We had to stay current on contemporary global health issues as we prepare the next generation of current global health professionals. As we all know, global health over the last 2 decades has significantly improved, but not for everybody, not for everybody. The trickle-down theory has stipulated that economic development will eventually affect everybody positively. With increasing wealth, all boats will rise. That is not the case. It is simply not the case. In fact, it seems that the law of gravity has been reversed, and we might call it a trickle-up policy, where wealth, not health, is highly concentrated. That means governments have to deal with these issues as a matter of urgency. And these new priorities are particularly visible, as I said, in urban geographies. I did an evaluation of Gavi a couple of years ago, and we found that the DPT immunization rates were 80%. Where are the remaining 20% we asked? In urban slum areas, hard to access, very difficult to get to, populations not cooperating, gang controlled. These are the issues which we are dealing with. We need also to look at the impact of our present economic policies, where the social obligations of capital seems to have been gotten lost. Look at marketing of sugar-sweetened beverages, of tobacco in less developed countries. Let's look at the opioid epidemic here in the United States. Our conclusion, students need to understand the basic science, the global health, and the development scene. But also, they need to understand the politics of global health, a growing area of importance. We developed the Master of Science program, which is now 7 years old, has about 90 graduates, with these priorities in mind. But let me finally highlight a feature of our programs which we consider essential. In addition to the core curriculum, we require all students to conduct a semester-long research module in a low, middle-income country. This is not the traditional study abroad. It means living and working in a developing country for 3 to 4 months. This labor-intensive requirement provides a platform for the students to understand and manage health problems in a foreign low-income setting. To learn by doing, to strengthen professionalism and cultural sensitivity. Or differently articulated, our goal has been to make experiential learning a cornerstone of the degree. Georgetown is the only university in the US with such an experiential learning program. It has also had a branding effect for Georgetown. DEVEX, the media platform for the international development community, recently listed the Master of Science in Global Health as one of the 5 graduate programs for a career in global health. We were quite happy about that. Thank you.
So, as you'll probably guess, I'm not Katie Gottschalk. My colleague sends her apologies. A colleague of ours has had to return to Australia for a health emergency, and so she has sent me instead, which leaves you not only with the second best person, but also with a political scientist to talk about law. And so you'll excuse me while I do so, especially to John in the front row. So I also did not create the slides, so I'm going to put them all on, and then you can see them as we go. Great. So, the ONeill Institute, founded in 2007 to focus on both global and domestic law as it relates to and at the intersection with health. The Institute has 25 full-time staff and faculty, 50 RAs in a given year, as well as interns. And it was created to generate innovative solutions when it comes to the most pressing domestic and global health concerns. The idea is using law as a tool to address these health problems. So current challenges that we were asked to kind of address, and you all know the Institute, et cetera, 4 that we want to highlight as we think about right now moments that we're in. So one is the opioid crisis. So here in the US, the opioid crisis is very clear, and the Institute is responding to that by bringing on actually a new initiative and a new project director that's focused on addiction and public policy, with increasing attention to the international context, where we're seeing increasingly opioids go global. And so what does that mean? And there's very few folks focused on that, and that's one piece that we're responding to. HIV and hepatitis C here in the United States, we have an initiative, the Infectious Disease Initiative, that really focuses on that, including at the cutting edge of some of what the health service delivery pieces should be. Reproductive health and NCDs, including a major focus on obesity. The Healthy Families Initiative that's just been launched is focusing on this intersection to really harness the idea of a Catholic university thinking about the broader context of families, including what families need when it comes to good food, and thinking about these things in a legal context. And then finally, global HIV and TB, but also the deficits in accountability and political will when it comes to the international system of global health. And there we have the Global Health Policy and Governance Initiative. We have, and you'll also allow me to apologize because I thought we were in the next section rather than this section, so I've also under talked about the LLM, but we'll do both. The LLM that we have, the Master's in Law, is a degree for people with a first degree in law, with both domestic and global lawyers who are coming to the program every year, approximately split half and half, 25 full-time students every year from 12 countries. 35 different specialized law courses are offered at the law school, as well as practical experiences, externships, and a variety of opportunities to really build the idea of global health lawyers. 180 graduates from 30 countries have gone through the program thus far. So what are the current evolving political and economic contexts in which we are working? And so we chose two to focus on. One is actually the growing reality of populism. That as we think about law as a tool, the law and legal claims remain powerful as a check on authoritarianism, but also as a tool for citizens to demand rights. And that is a key piece of what we're working on right now. The second, as mentioned by Bernard just now, is growing inequality. And as we think about law and policy as a tool that either advances or hinders health, we have to understand that the drivers of inequality often have legal roots, and that the side of public health needs strong legal arguments and strong legal capacity to both respond to threats, but also to advance the capacity of citizens to demand health in the law. Two opportunities in places where we're leading. One is kind of bringing the legal expertise, and so I won't go into the Lancet Commission, but John mentioned that, stolen my thunder, I forgive, and he was the co-chair, so he should steal the thunder, but led by Larry Gostin, that really is building the field of the legal determinants of health. I can't tell you how many people have recently talked about John and Larry's work to me as really cutting new ground when it comes to kind of really creating this as a field within both academia and within the practice of global health. The second I'll just highlight for a moment is on NCDs and obesity that we think can be responded to with law, and it can be done globally. And so our Healthy Families Initiative is currently convening civil society, lawyers, and public health people to both defend public health laws that support good public health, but also to advance measures that demand that the state take action. Finally, I'll just say the final piece that we're really trying to lead on is a piece on empirical rigor. That as we think about what laws are actually linked to better health outcomes, we have intuitive sense of what that is, but we don't always have evidence for it. And so a new project that we're just launching called the HIV Policy Lab will track which policies related to HIV have been implemented by which countries across the globe and across at least beginning 3 years and many years to come, so that we can actually build evidence and ask empirical questions about which policies and laws are getting us better health outcomes and which are not. Thank you very much.
That was incredible. Thank you so much to a really amazing panel. And I think, you know, one of the themes that really runs through is the interdisciplinary skills that are needed to address global health. Whether, you know, as Professor Singer was saying, that, you know, training all his students in media training and communication, or having a political scientist speak about the importance of using law to address global health issues. You know, we all recognize that the challenges of the day require us not just have a biomedical approach, but a social approach and a political approach. I do want to take a few minutes and open it up to questions from the audience, either for a specific member of our panel or for the panel as a whole, as we sort of discuss the breadth of academic programs here at Georgetown. And we're just going to, because we're recording it, we're just going to give everyone a microphone, even though I know everyone's very good at projecting.
Is this on?
Yes.
Yeah, hi. Paul Ropey from chemistry and biochemistry. And on the breadth question, I'm very intrigued by that. And I don't know who I should ask first, maybe Bernard, but do we have a feel across this group here of how many students we have in these different categories, undergraduate, graduate, master's, PhD? Is there somebody keeping track or doing inventory as we think about building these cross-programmatic bridges and so on?
Well, we're two of the three undergraduate programs and also two of the master's programs currently represented up here. The third undergraduate program in STIA, and Emily Mendenhall will be here later this afternoon. And I don't know that we've there's no one person on campus coordinately looking at where are global health majors going as undergrads, where are they going at the master's level if they're interested in any of these disciplines within global health. As I was listening to my colleagues and thinking, what are the challenges that I'm seeing? One of them is our branding, both internally and externally, with these multiple overlapping programs, we see very clearly that they're different. But I don't know that we advertise that they are different or exactly how they're different so that students know exactly where to go. So we are getting plenty of applicants, and this is one of the jobs as the director of the major. My name's on the website, the students will apply, or before they apply, they'll email or call me and say, should I be applying, to the School of Nursing, to the School of Foreign Service, or to the college, because this is what I want to do. And if they know what they want to do, it's actually very easy to guide them. When they're a little less sure, then I have to just explain how I see the differences among the programs. And the same thing happens at the master's level, but I think that's probably the biggest challenge we have. Actually getting data on how many students are going through each program would also be useful, as well as where the graduates have gone, and I think independently we're all doing that, but it's not being managed in a cohesive fashion yet.
We do have some of the data in the graduate program, at least. We know that 90 people have gone through, and we know that nearly everybody is employed, so we have an alumni survey. But on the undergraduate programs, the situation is very different, right? Because I have no idea how many people go through biology of global health. We coordinated the websites so that people can make a choice between biology of global health or global health. So that has been articulated. But I know that in our programs we have about 480 alumni over the years, and Miriam will be able to tell us more where they have been.
Where they go, every different industry here. You see international organizations. Oh, sorry. So we know we have over almost 300 who went abroad for a semester. We know that many of them are. We did a survey of the alumni last year, and we asked them where they ended up, what they did. All of them went to graduate school. Many, maybe 20% to medical schools, the others to master's programs, on to PhD programs. We have alumni working at WHO, we have alumni working at other international organizations, many in NGOs, many in consulting firms, USAID, and so on and so on. So we do have that data, but we have to also keep track every year, and we send out surveys, but we don't always get, of course, replies from everyone. And we have a big data set, an Excel sheet, where we every year tally whatever we know. But of course, some people go through the cracks and you don't necessarily know. But for many of the alumni, we could actually contact them right away, and we know that they are still working in global health, the large majority of them.
I think it would be...
Oh, sorry, Miriam Vučković. I'm faculty in the Department of International Health, and I'm directing the undergraduate program.
But I would like to add, it would be very useful to get the data together in one place. It would be really helpful.
And just to remind you, within GHI, one of the things that we are working on is to help coordinate across, because although we see each other as separate programs, externally, we are one Georgetown, and so that's what students, when applying, expect. So I think, anyways, this is a very useful conversation for us. Other questions?
Hi, I'm Chris Lafredo from the Lombardi Cancer Center. As somebody who's worked in global health for 20 years, what I find now, and maybe more and more, is that the lessons we learn about culture and language and religion and ways of looking at the world in global health couldn't be any more relevant now in addressing the US's challenges of an increasingly diverse population. I wonder if our panel could comment on how we're preparing students to address those things. I know Steve said a few things about culture and social and behavioral factors in relation to health, but I suspect this weaves through all of them.
Let me answer. By sending our students abroad, all students abroad, we obviously would like to provide experiential learning. But if you are put in a foreign environment, in a low-income country where you have to work, not to observe, to work, to get a study done, you have to somehow see how you fit in, right? The environment will somehow shape you. I think it is a training in cultural sensitivity and humility, which is very, very important for the students. We don't know it all. Other people have views which are very relevant, even if they live in low-income countries. Could we do more there? Yes. And it is very interesting. Let me give an example. We have sent students to communities on the other side of the Anacostia River, so where you have the glass ceiling, where you have really difficulties. And when they come back, we ask them, how has it been? Oh, yeah, it was interesting, was interesting. The same student, we sent them to Australia, industrialized country, to work with Aboriginal communities. And when they come back, one asks them, how has it been? And the answer is, well, the Australian government needs to do something. We need to really, that can't continue. The cultural blinders are taken away, right? The focus, we can't see it if we are in it.
Yeah, I'll just comment as well. So I've been teaching for a while. As someone who's lived in Asia and Africa and who spent 5 years living in Zambia, one of the things I really try very, very hard in all of my classes is to ask questions in a way that flips some of the questions. So I will ask students, so what if we had 3 students who had recently gotten their master's in Rwanda and came here to look at the US government and make a report? What would you expect them to do? I do a lot of work on behavior communication change and what that means and how it's important to be engaged directly with the community. I mean, on one hand, there's prevention. You can think of things like wash and sanitation. But on the other hand, when you're responding to an epidemic like Ebola, trying to think of just doing biomedical interventions will get you a small way to where one wants to be. So I think it's really important that we continually challenge the students, not just about sort of the academics of what we're doing, but how we're doing it and how to be sensitive to where one is sitting and the role of power in terms of where one is sitting.
The only thing maybe to add, I mean, that we certainly have discovered is that the LLM program does recruitment globally. And as I said, about half the attendees at any given moment are from outside the United States. And that has really brought a richness into the classroom and into a variety of contexts for the program, in that the microcosm of the United States as the norm is often not the norm, right? The majority of students in many classes have not grown up and been trained as lawyers in the US system. And that has proved hugely challenging to others who have just assumed, well, this is the law, right? And so when you kind of problematize that, we've not only seen better student outcomes and better student thinking kind of about the global projects, but also about US law, really understanding what is the context in which we're working. So to your point, there's real value in kind of creating that opportunity to reflect back and to challenge assumptions about what American-trained and American-born folks have come up with. And we were able to do that in the classroom, and that's a really interesting opportunity.
I would like to add to that one, because a very important point. Learning appears in the classroom amongst the students. So we have been with the graduate program systematically, radically, I would say, trying to have a really diverse group. It's not the GPA only which matters. It's a personality, it's a background, it's a learning experience, it's a context, it's a culture which matters. To put them together, and to put them together in a manageable group, not 35 or 40, 20 to 25. It really rubs off. It really rubs off. And I think it's extremely important.
Thank you so much. And one of the things that the Global Health Initiative is organizing this spring is a global learning exchange, which will currently, as envisioned, will look at 3 topics which were listed at the part of the World Health Organization's top 10 global health threats for 2019. And that global learning exchange is about the bidirectional learning that needs to take place, because when we think of other cultures or other religions and other languages, I think that puts us in a mindset that we're looking outside the United States. But we're really not. That if we're looking at the health issues that are of particular importance to vulnerable people and people in low resource settings, it's as real in our own backyard as it is overseas. Sorry. So I think that's an interesting piece where we can bring some of these conversation together and the work that we're already doing, looking at how do we address sort of those bigger picture issues of what are the most critical issues, and how do we engage people at their in a way that makes sense. John, I saw your hand up. Did you have a?
I was just going to, I want to echo the point that Matt made. Thanks. I teach the global health law class that's required for all the LLMs, and we use simulations in a way that is more extensive than in most law classes. We have a mock World Health Assembly. We have teams negotiate contracts. They negotiate they negotiate a vaccine contract. But what's most interesting to me is when the small groups get together, the pairs. They are often, because of the nature of the program, people from different legal systems, different cultures, different first languages. It is an unbelievably powerful experience watching them learn from each other, and the Americans learn the most, in my experience, because they're the ones who have most likely had the least opportunity to sit as a peer professional with somebody else from another country trained in another system. And so actually what led me to the other piece of multidisciplinarity, it seems to me, is both a worldview, but it's also the willingness to acknowledge that your expertise is not the end of the story. And so I wonder if you've had experience in teaching where you've helped the students who've come through, whether it's the science door or the law door, see that they have to find ways to partner with not just people from other cultures, but people who have an expertise different than their own. And is that part of what we learn?
So I mentioned this for the global health, biology of global health majors. In their undergraduate gateway class, every project they're doing that semester is a group project, and they're switching up groups for everyone, and each project is a different format. And so one of the things they explicitly do at the end is rate and report what was their role in the project. And sometimes they were the technical person because they had some facility with GarageBand for making a podcast, or they had experience with AV for making a Stolze journal type of presentation, whatever the format is. And other times they're take on the content expert role. Sometimes they take on the leadership role. And it's rare, actually, and very interesting to see that it's almost never the same student being the leader every single project. They really don't want to be the leader every time. And we'll sometimes encourage some of them, do step back and let somebody else in their group for one of the projects do that. And so they do develop that expertise. It's, I think, also the fact that in that course, we bring in a lot of guests to facilitate it. Felice has been in, Bernhard's been in, and probably more of you in this room have been in as well in that course, or will be soon now that I'm running it. Just because I readily admit that many of the things we talk about, almost everything we talk about, is not my expertise. And getting in that help is really useful and gives them the feeling of power to know that, yes, he's the professor, but he's not an expert on everything.
Yeah. I'll just say in one of the classes I teach, I have students from 4 or 5 programs across this group, and I always assign the groups, which the students don't particularly like, but I very purposefully mix them up, and I very purposefully, for those who do not have experience in the professional world, share this is the way it's going to work when you leave academia and move into project-based work. You are going to have to use your expertise, but you're also going to have to communicate and have strong relationships with your group so you can draw the best out of them. And they often, what the feedback is that's the hardest assignment in the room. Yeah.
One that I will just mention briefly is the idea of a right to health is a thing that Americans really struggle with, especially American lawyers, right? So as one unit in a class that I teach, we really delve in depth and we read a number of cases from around the world where judges and lawyers are grappling with what constitutes a right to health. And American lawyers have a very hard time because they think this is some very nice rhetoric that you've brought in, this right to health, ha ha ha. And yet, globally there is a deep and robust and complex jurisprudential set of questions that are asked that include differences jurisdictionally about who understands the right to health in what way. And it actually gets into some very deep and complex and really interesting areas of the law in terms of what is the role of the state in provision, what is the role of the state in protection, et cetera, et cetera. And this is one where Americans often, I have found, leave the room thinking to themselves, I not only was not trained in that, but I was never even socialized to the idea of that. And then leaving, being able to actually have a different kind of conversation. And so that piece alone is just very interesting.
Oh, that's a great example, and something that we've all experienced firsthand. There's one more, Paul?
I had a comment on top of my question as I'm sitting here thinking of these things and hearing the replies, but I'm struck by another curiosity in our overall global health portfolio at the institution, which is that there's an awful lot of students running around in other programs that are not officially labeled global health programs of one sort or another. I have, for example, a Jesuit, an ordained Jesuit in my lab studying malaria that's in the biochemistry program at the medical center and isn't officially affiliated with the global health, but he's one of the more insightful people that I've met in my time here on some of the things that we're talking about. I know Jesse and I we're sponsoring fellows from the USP, the United States Pharmacopoeia, which I always mispronounce, and they're studying, the USP is supporting a new institute called the Quality Medicines Institute, which is deeply involved in trying to understand substandard and counterfeit medicines across the globe and how that impacts, infectious disease and so on and so forth. So I'm struck by the fact that we have, and that's just the tip of the iceberg, I'm sure, we have a lot of students running around. So what can we do? I'm just throwing this out there. What can we do? What can we think about doing in terms of bringing them into the fold, so to speak, or bringing their educational programs, the things that they're developing, and these other interdisciplinary expertise that they have, bringing that into the community so that all of the students can benefit.
There's a question for John. Clearly.
I would say one of the challenges of the last couple of I'd say one of the challenges has been connecting. I mean, individual students that participate, like in the fellowships, we've had good success. I think we've had terrific interest in the applications, but there's a number of student groups who do global health, but that doesn't really capture what you're talking about, Paul. It would mean our thinking across academic programs and across students in a more systematic way than we have, and categorizing and at least finding individual people who raise their hand and have those kinds of expertise that we'd have to build a community of the students as well, and we've had less luck so far, but it would be terrific if people had experience in other areas that could help with the design of that. I don't know if anybody else here. Bernard, you've been here.
I think what would be really nice as well to have a list of courses which are available, and which really are available, because often the courses are there, but then they say, no, it's core course limited, you can't get in. But so that you have a list of courses where people could choose from. They're very interesting, which are related to global health, but not directly. For example, agriculture policy, nutrition policy, which is taught by SFS, And so there are many of these courses which really relate to the field and which people would like to take. And when you have them in the class, you have them in the class, right? They make a contribution.
And I think part of what the Global Health Initiative is trying to achieve is becoming that hub, that resource for students. So and for professors who say, look, I'm not really a global health professor myself, but I do this thing or this one piece, and how do I get engaged? So we did create a global health course list on the GHI website that tries to, for students interested in global health, they can go through and select them. That being said, if people don't know about it, it's a tree falling in the forest with no one there. But I think that you know, that was an idea that was brought to GHI, and so we could create that sort of global good for the university. So to the degree that there are other things that GHI could do in order to disseminate information and help with that coordination, the ideas would be, you know, we can't do it without ideas. Oh yeah, sorry, Tim.
Sorry. So I have a comment too. I agree
And
with.
Tim, can you introduce yourself?
Yeah, I'm Dr. Tim Frazier. I'm the faculty director for the Emergency Disaster Management Program at SCS. So I agree with the comment. I think it's fabulous. I think we sometimes think about sort of the thing that is in our most easily in our wheelhouse, and there's probably many programs on campus that could lend expertise to the societal problem that we're trying to solve. And I know in my program, in emergency disaster management, I have a good number of students who work in humanitarian crisis across the world and a bunch of different organizations. And so I think whatever way we could best sort of take advantage of the expertise that's on campus would be great.
Hi, my name is Neeraj Mistry. I'm in the Department of International Health, and one of the courses I teach is global mental health, which is becoming quite popular. And the response to global health is not a medical response, it's interdisciplinary. And there's been some very interesting discussions with the departments of sociology and anthropology that I've been having. And I wonder if we could look at, because we often say in global health, who's not in the room? And certainly we have medicine and global health and law represented, but not sociology, media and communications, all of which have huge impact in behavior change and lifestyle modification, which is going to be our major intervention in global health moving forward. So it would be good to see how we can use courses or themes as sort of smaller models to look at sort of broader inter-faculty collaboration.
It reminds me of a course that Professor Apter and I are thinking of creating together, which is completely interdisciplinary on vaccine hesitancy. So, but it also gives us a great idea for how we could structure our faculty forum for 2020. We are at time, and I want to have time for people to get coffee, but are there any other last questions? Dr. Hilton, I didn't know. Before we break. Okay. I want to thank our panelists for their time and their thoughtfulness.